I'm really excited to be starting manual therapy 2 class. Just reviewing some of the prompts. My strongest area, I think, would be joint mobilizations, as long as it's 1 through 4. I'm happy that we reviewed the mechanisms behind joint mobs because it's been a while. I don't, in my opinion, think it was explained thoroughly in the first place to me, or I didn't understand it maybe when it was being taught. So I was excited that we reviewed that. My weakest would have to be neural glides, tensioners, or any of the neural tension tests. I love that we learned it. I took one class during like a district conference that didn't really cover it, and I didn't learn it in my undergrad. So that's definitely the one that I do not feel the most comfortable with, because when we learned it, I wasn't in clinic. So I was only practicing it on my wife, who didn't necessarily have it. So knowing an indication for it, knowing when there is an indicator for utilizing it or testing for it, that is helpful. But recognizing when I need to do it, I guess without that background knowledge, might be a little bit challenging for me. I'm also not comfortable with grade 5 mobilization. That's because I didn't have anyone to practice it on. I've never felt comfortable necessarily doing it. Definitely didn't understand the mechanism behind utilizing it. And then my wife, who suffers from chronic pain, chronic back pain, was definitely not a candidate for utilizing grade 5 mobilization on the spine, which is the one I'm the least comfortable with. So I think transferring all of this knowledge, I can definitely integrate some of the knowledge that I've gained into clinical practice. Besides the challenge of having clinical practice at all, I think another barrier I might face is asserting myself to apply the knowledge when I don't feel confident in doing so. You know, being a good clinician, I think, is about applying what's necessary to the patient. But part of it is like knowing your limitations. And since those have always been my limitations, those things have been my limitations, or I didn't have the knowledge, it's going to be difficult to say, like, I need to feel confident in applying that when I haven't ever felt confident before. And now I've never had a live patient to practice these things on. But I am really excited to do joint mobs. I'm really excited to become more confident in those things. I'm very excited to use a manipulation belt, because I think that those are very low risk activities that I can apply immediately, so long as we have clinic.